Hey, what's going on, everybody? It's Trading Chief. If you're new to the channel, welcome. Uh, in this video, I want to talk about an upcoming merger. As you can see, uh, Regeneron Pharmaceuticals has announced they're going to buy out Decibel Therapeutics, and they're doing it at roughly $4 a share. But it's over $4 a share, so I wanted to kind of cover that and talk about why this is happening. As you can see, I'm kind of sick again. Um, never fails. But let's go over the news article that came out. It says Decibel Therapeutics Inc., ticker DBTX, stock was up 85% in pre-market trades on Wednesday after Regeneron Pharmaceuticals said it would pay $4 a share for the Boston-based clinical stage biotechnology company with a focus on discovering and developing transformative treatments to restore and improve hearing and balance. The $4 a share stock price to buy Decibel Therapeutics amounts to a 43% premium over its closing price of $2.79 a share on Tuesday. Regeneron's acquisition price values Decibel Therapeutics at $109 million, or up to $213 million in milestones are met. So this is where the extra pricing comes in. Prior to Wednesday's trades, Decibel Therapeutics was up 36%. So what they're doing, right? If we go over here and we look at uh, the 8K that they dropped, it says on August 8th, 2023, Decibel Therapeutics entered into an agreement and planned merger with Regeneron Pharmaceuticals Incorporated, a New York corporation, a Symphony Acquisition Sub Inc., a Delaware corporation, and a wholly owned subsidiary of the parent. So, pursuant to the merger agreement, and upon the terms and subject to the conditions therein, purchaser will commence a tender offer to acquire all of the issued and outstanding shares of the common stock par value of the company in exchange for $4 per share, payable in cash at closing, without interest and subject to reduction for any applicable withholding of taxes, plus one contractual non-tradable contingent value right, or CVR, per share. Each CVR, which entitles the holder to potentially receive contingent payments of up to an aggregate of $3.50 per CVR. So without interest and subject to the reduction of any applicable withholding taxes upon the achievement of certain specific milestones described below in accordance with the terms and subject to the conditions of contingent value rights agreement, CVR agreement, to be entered into with a rights agent, mutually agreeable to parents and company, cash consideration plus one CVR together, the offer consideration. The offer will remain open for 20 business days, subject to extension under the certain circumstances. So let's see what the CVR is, right? Because you could be holding this stock, you could be holding the CVR for up to 3 years. Generally, what I've seen is it's based on, human trials and then being approved by the FDA and la da 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 da. And if depending on what phase this drug is in that they're looking for specifically, it could be 100 and it could be 3 months to 3 years depending on what phase they're in for this. So it's something that you definitely need to look at before you decide to buy into this. But effectively, you could make um, even at the current price, which in the after hours is currently at $4.96. Uh, if you don't mind holding it, you'll take an initial loss selling at $4, but the CVR down the road per share will give you more. So it'll give you $3 up to $3.50 per CVR. But let's see if we can find and see what the um, CVRs are need to meet in order to be paid out. right here. Contingent value rights agreement. So each CVR represents a non-tradable contractual contingent right to receive the following cash payments without interest and subject to reduction for any applicable withholding of taxes. $2 in cash without interest and subject to reduction of any applicable withholding of taxes payable up upon the fifth participant being administered with DBOTO. So you had to have 5 people administered in a clinical trial to get the $2 cash on or prior to the earlier of December 31st, 2024. So that's what I was talking about. It could be a long time before you get the payment for that. And the termination of the CVR agreement uh, and the DBOTO milestone expiration date. You get $1.50 in cash without interest, subject to reduction of any applicable withholding of taxes payable upon the first to occur of the first participant being administered with DBOTO and a registration enabling trial. So that's your phase 3 trial. Uh, the receipt of acceptance for review of a biologics license application by the FDA. So you gotta get a BLA from the company, a marketing authorization application by the European or the EMA, the European Medicine Agency, a marketing authorization application by the UK Medicines and Health Products Regulatory Agency, an equivalent application by the applicable national regulatory authority in any of the German, France, Italy, or Spain, in each case for DBOTO, provided that the DBOTO milestone has been previously achieved prior to the DBOTO milestone expiration date, and the registration study milestone is achieved prior to the earlier of December 31st, 2028. That is 5 years away, guys. Um, Me personally, I I mean you can buy the shares, tender them to Regeneron. You'll take a small loss. I think it's like 90 something cents right now, and then you'll still get your CVRs. But I mean, do you want to take a loss in order to hold something 5 years to get a $3.50 payout? I have full um, confidence in Regeneron being able to meet all these goals to get it paid out, but that's a long time to wait for $3.50 per share. You know what I mean? Like, I think you can make a lot more money doing something somewhere else. I mean, you're not gonna be holding up money on this because you're gonna sell your shares to CVR, and then this would just be cash that pops up later on down the road. But that's a long time. So just something to think about. Um, and that's really all I've got for you. If you made it this far in the video, I appreciate you watching. Consider hitting that like and subscribe button. Come check me out in the Discord. Link will be in the description down below. And do me a favor, leave me a comment. Let me know where you're watching this from. It's always interesting. I get views from all over the place: India, Pakistan, Australia. Just let me know where you're watching from. I think it's interesting to see where my audience is at. And that's all I've got for you. Again, have a good day, and I'll catch you in the next video.